The University of Kansas Hospital is making progress in the switch from paper to electronic records. What does that mean for your security information? KUJH-TV's Courtney Condren has more.
Gone are the days at the University of Kansas Hospital of nurses scribbling down your information as you talk. Gone is the wait for medical records to be faxed from unit to unit. And no longer will you be asked, do you have any allergies? As part of a 5-year transition, the hospital is switching to all electronic medical records, or EMRs. The hospital is currently in the second stage of implementing this system that doctors and physicians help choose. Now, all records within the hospital are online, making them easily transferable from department to department. Not only does this help doctors gain awareness of a patient's medical history, but the system also decreases errors.
We've had patients come into the emergency department, and because the patient was seen in one of our ambulatory clinics, they already had a lot of information about that patient, what medications had been prescribed to them, what they had seen their family practice doctor about, and so that was really helpful, where in the past that record from family practice would be in that office, not visible at all by the emergency department.
The implementation of this system has benefited the hospital's efficiency and accuracy, but there is skepticism about the security and privacy of those records. Learning of past medical problems can help a doctor treat a patient, but this does mean a patient has to sacrifice some privacy. For example, if a patient goes to the hospital for an appointment with her gynecologist and then comes back to the emergency room 2 weeks later with a broken foot, the ER doctor will be able to see anything recorded by the patient's gynecologist, even though it may not have anything to do with her foot. The good news is, not just any doctor can look up your information.
For physicians, we have security set up so they can access the patients that they're currently taking care of, but there's also physicians that are consulted. So even though, let's say, a particular internal med physician may be caring for a patient, but they want to consult an ENT physician, that ENT physician would have access to be able to look at that patient's chart in order to care for that patient.
So what's to come in the future? That starts with patients making appointments and accessing their information online, and someday may lead to all of a patient's history being programmed onto their insurance card. For now, the hospital is concentrating on having as much of a patient's history online as possible. Courtney Condren, KUJH-TV News.